From 1st April 2022, the Ministry of Manpower will implement a new primary healthcare system for our migrant workers. This video will show some simple steps on how you can support your workers in accessing primary healthcare. To ensure accessible healthcare for our migrant workers, we have reorganized the new system into 6 geographical sectors. Each sector will be managed by one anchor operator. Sector A by StarMed Specialist Centre, Sectors B, C and D by SATA Health, Sector E by Fullerton Healthcare Group, and Sector F by St Andrew's Mission Hospital. The anchor operators have vast experience in caring for our migrant workers, and they will wrap care services around the needs of our workers, including unlimited acute and chronic consultations and treatments through consultations at the medical centres or telemedicine, medical examination, basic health screening, and convenient transportation between dormitories and medical centres. These services will be offered at a fixed annual price under a primary care plan or PCP to meet most of your workers' primary care needs. This PCP will cost between $108 and $138 per worker per year. For your convenience, you are encouraged to pay this in monthly installments. However, you may also choose to pay this quarterly, 6 monthly, or once every year. With the PCP, you can expect to save at least 20% when compared to the annual cost of GP consults you would have to spend for each worker. So you might be asking some of these questions about the PCP. Which workers are eligible for it? How do I buy it? And when do I buy it? Let us look first at who is eligible for the PCP. All work permit and S-Pass holders are eligible. From 1 April 2022, employers must buy the PCP for work permit or S-Pass holders who stay in dormitories or work in the construction, marine shipyard, or process sectors as part of work pass requirements. The PCP is optional for all other work permit and S-Pass holders such as non-CMP workers living in the community or working in other sectors such as manufacturing and services. However, we encourage all employers to buy the PCP as they will provide cost clarity and strengthen protection against unexpected healthcare bills. So, how do I buy the PCP? You must ensure that you buy it from the right anchor operator, managing the sector your workers live in, and at the right price. First, identify the first 2 digits of the postal code your worker lives in. In this example, this worker lives in postal region starting with 22. Using our self-help checker, key in 22, and it will show that he lives in Sector A. As such, you should buy the PCP from StarMed Specialist Centre, managing Sector A for him, at $138 per worker per year. Next, when is the right time to buy the PCP? You should buy the PCP after your worker has completed his or her statutory medical examination. This can be done in 2 ways. 1. Workers who need to go through MOM's onboard centres will complete their medical examinations there. 2. Workers who do not need to go through the onboard centres will get their medical examinations conducted with the anchor operators. Once your worker is certified fit for work and you are ready to get his or her work pass issued, you must buy the PCP from the right anchor operator. Finally, what happens if my worker moves? For example, my worker has moved from Sector B under SATA Health to Sector F under St Andrew's Mission Hospital. You are encouraged to switch the PCP at the earliest opportunity, according to the new sector that your worker will live in. In this scenario, you should terminate the PCP with SATA and purchase it from St Andrew's Mission Hospital. This ensures that your worker continues to have good accessibility to care. There is no prorated refunds for the terminating month, but the worker can continue to seek care at SATA till the end of the month. If you have bought quarterly or yearly PCP, refunds will be made for the unused months. Alternatively, you may choose to maintain the PCP with SATA in Sector B to preserve the existing relationship your worker has with his or her doctor, or if the move is temporary and accessibility is not an issue for the worker. We hope that this video has helped you to understand the key features of our new system as we work with you to build a more resilient healthcare ecosystem for our migrant workers together. Please scan the QR code to find out more. Thank you for your support.